Fender bender. Millions of people every year involved in what they would think a very minor car accident. That's what they call it, fender bender. Just yesterday, I saw a patient who said, "Doctor, I was standing in the red light about 2 weeks ago and somebody just hit me." Literally, it was a very light hit. Yes, it gave me a little whiplash. I didn't make much out of it. It came out of the car. My car, there was practically no damage at all. Maybe some minor scratch. I was in a hurry. I said, "Okay, don't worry about it," and I left. Later that evening, I started feeling some discomfort in my neck and my lower back. And now 2 weeks later, I'm in a lot of pain. And guess what? There's a lot of people just like that. What seems to be a very minor whiplash sometimes creates a very major problem. And today, we're going to be talking about ligamental instability, or also called spinal instability problems. I'm Dr. Lipnitsky from Tri Physical Therapy and Pain Management. And today, I'm going to tell you everything you need to know about this very usual, very common problem called ligamental instability that often caused by such a minor thing as a fender bender. In our clinic, we see hundreds of people every single year that come to us with the same complaint of chronic neck, mid-back, or lower back problems. And a lot of them have the same history behind. Back in the days, could have been a year ago, 2 years ago, 10 years ago, they were involved in a very minor accident or very minor injury that seemed to be just a soft tissue problem. Yes, I had a little spasm here and there. Maybe it was even treated, and often they were also diagnosed. They went through a series of tests, including MRIs, that were trying to identify whether there was a problem with a disc. Maybe some of the discs got injured and herniated, or some other problems like tears, and nothing was found. The doctor said to them, "Look, there is nothing wrong with your spine. You have some very minor changes, but guess what? A lot of people have those changes without any symptoms. So good news, you're absolutely healthy, and whatever is happening in your spine, those minor aches and pains, they're gonna go away real soon. It's just a muscle spasm." And then it came back again from very minor physical activity. The doctor said, "Well, you get another spasm again," and maybe gave it a treatment or some medication, and those symptoms started to appear more and more often. Now people are struggling because they cannot stand for a long time, cannot sit for a long time. They definitely cannot lift things because it requires bending forward and back. Now they're getting pain while they're working, especially if they're sitting during work. And now they're seeking a resolution of the problem and really put a finger on a diagnosis. So the problem that's often missed, and many clinics don't even test for it, is an injury to the ligaments. Ligaments are structures that holding the whole spine together. It's those hard wires that connecting the vertebrae together, connecting each bone together and holding it as a structure. You probably realize that the spine, the structure of the spine, is a stack of bones that is separated by a small gel-like structures called discs. So it's very unstable structure. And the only way to make it stable is through the hard wires or little ligaments that connecting each vertebra to each other. And there's a longer ligaments that connecting multiple vertebrae to each other, and even further, more ligaments that connecting the whole spine together. So it's a series of ligaments, and those ligaments are first line of defense for the spine. So during the injury, let's say the neck, for example, the spine violently shakes forward and back. That's what we call whiplash. And as it goes forward and back, and sometimes sideways, depends from which side the injury occurred, those ligaments sprain, they pull apart, and sometimes they even rip. But generally speaking, that first line of defense gets damaged. And if it's not diagnosed and not treated, it becomes a very loose structure. So now that first line of defense is practically gone. And we're relying on musculature to hold things together. First of all, muscles hurt if they constantly have to work, and that's why you're getting a constant muscle spasm. Second, muscles often are weak because a lot of people don't have a strong musculature. So that line of defense becomes also really not a defense at all. And at this point, we're running a very high risk of a serious spinal injury because the spinal cord that connects the brain to the rest of the body is really not protected by anything. So if you're involved in a car accident, even just a fender bender or any other falls, and you're seeking help from medical professionals, please ask them to check for spinal instability. It's a very simple test. It's a stress test for the ligaments that can be done through x-rays, and it's a specific form of x-rays that we can check and measure the degree of motion between vertebrae. And once we understand the degree of motion, we can say whether the structure is stable or unstable. So your next question is probably, okay, if it's unstable, what do I do? Well, good news, there's a treatment for that. And I will do a separate video explaining exactly what type of treatment we created to restabilize the ligaments. But for the sake of this video, you need to understand that the basic injuries often end up with very serious chronic conditions. If the structures become unstable, they start moving more than they should. And in relation to the spine, if the spine is unstable, now you have too much movement between vertebrae. That will long-term create a severe damage not only to your disc, and that's what we call a degenerative disc disease. It starts degenerating or breaking down much faster, but also to a facet joints, little joints that connect the vertebrae, those little bones together. And together, it develops a degenerative spinal condition or arthritis of the spine. As a matter of fact, most common cause for the degenerative spinal conditions, whether it's a degeneration of the disc or degeneration of the joints of the spine, is an instability. And usually it came about from a small fender bender or some other light form of injury that was not properly diagnosed and was not properly treated to restabilize the spine. So if you are suffering today with arthritis of your spine, you have to look back and think back. There was probably an injury to your ligaments years before that now you're paying for. Please remember to ask your doctors to check for spinal instability and make sure your attorneys know about that as well, because in many instances it will change your case and you can definitely win significantly more money for the damages to the ligaments that often irreversible or reversible, but through a lot of treatment, and you should be compensated for your pain and suffering. By the way, if you like this video and you like this information, please let us know. Give us a thumb up or even subscribe to our videos, and we'll be happy to put significantly more information out for you. By the way, ligamental instability can be found not only in the spine, but other joints as well. For example, the knee. If you sustain an injury to the knee and it went through excessive motion, most commonly we're gonna get some damage to the ligaments. Now, on MRI, we might not find anything at all except for just some light inflammation, or we'll call edema, around the ligaments or joint that usually goes away relatively quickly, even without a treatment. But most of those injuries create ligamental sprain, and that sprain creates an instability. Now, the ligaments that's supposed to keep the stability of the knee are no longer there, and the knee starts moving excessively in many directions, which usually it doesn't move. For example, shearing, so the motion right to left, side to side, or even forward and back. Now, this is not a normal physiological movement for the knee, and of course, when something goes through abnormal movement, we would expect certain damages that this movement repetitively over the period of time will bring about. And there's a direct damage to the cartilage that wraps around the joint itself and allows that smooth glide that will occur, and also to some of the meniscus that are cushions between two bones. So this abnormal and often excessive movement will most definitely start destroying over the period of time the cartilage as well as the meniscus of the knee. By gliding the wrong way and gliding excessively, it will break the cartilage, create erosions within the cartilage, and the position of the calcium, which is exactly what arthritis is. Also, the cushion, the meniscus, will start frictioning, the bone will start frictioning against that meniscus and slowly start breaking it apart, creating a tear. So, through the repetitive motion that may take months, years, or sometimes decades, it will start breaking the joint apart, creating significantly faster degeneration or arthritis of that joint. The same problem can appear in any weight-bearing joints. Why weight-bearing? Because the joints that holding the weight, like ankles, knees, and hips, are more prone to this excessive movement because we're constantly loading them with weight. And that's why we see so commonly the development of arthritis in one knee and not the other, in one hip and not the other. Same thing for the ankles. Why? Because at some point the person had an injury, and the injury brought about the ligamental laxity or stretch of the ligaments, and that lost the integrity of stability of the joint, and that brought about degeneration process due to repetitive abnormal movement. So you can see how this chain of events will take place and slowly start breaking down, destroying one joint or the other, creating long-term effect. So if you were involved in an injury, please make sure your doctor not only tests you for basic things like meniscal tear or labral tear if it comes to the ligaments of the hip, but also look at some instability studies and see if there's excessive movement in that joint. If there is excessive movement, there is a treatment for that. You don't need to have a surgery. Yes, of course, if the ligament is completely torn, the surgery is required. But right now, there's a lot of great treatments that rebuilds the ligament. We call it regenerative treatments that can be PRP or stem cells, or we often use ozone therapy. We also use prolotherapy. There's a whole line of things that we can do today to stabilize the ligaments and really cure the problem long term. If you have any questions, please write to us. We're very happy to answer those questions, or you can call or even come and visit us, and we'll be happy to help you with those problems within the office. Thank you for watching and have a wonderful day.